Every year, cancer kills more than 10 million people worldwide, leaving families grieving and potentially bankrupt. By 2030, AI will make cancer treatments cheaper and more accessible. How so? Let's break down the revolution of healthcare that's brewing. Why Cancer Moonshot is important. The US government has an ambitious yet groundbreaking plan. By 2047, it wants to accelerate the treatment discovery plans that would ultimately reduce the deaths caused by cancer by 50%. Of course, it would take an army and some more to achieve this goal, or to be more realistic, to even start building the infrastructure to kickstart Cancer Moonshot. But the year 2023 changed a lot about the leadership of the project. While the federal government was actively pursuing researchers to shape up the project, it was artificial intelligence that proved to be the momentous ally. Experts believe that the new generative models of AI will help achieve the two very key tenets of the plan. Firstly, the call to deliver the latest cancer innovations to patients and communities. And secondly, enhancing the oncology model to place cancer patients at the center of decision-making. We'll talk about the practical implications of AI in revolutionizing the treatment plan, but there's something spectacular about Cancer Moonshot that will change the world. You see, cancer treatment has always been inequitable. The expensive treatment plans have rendered resourceless patients helpless in the face of it all. Not to mention, when it comes to cancer research, certain racial and ethnic minorities were left behind. Even though AI models are plagued with allegations of rampant racism and discrimination, experts believe the generative models will make cancer treatment accessible and equitable. How so? Will AI make cancer treatment accessible? Before everything else, Cancer Moonshot wants to deliver innovative treatment plans to everyone and just not handpick people in society. And well, that just seems to be the prerequisite for building AI generative models, right? Artificial intelligence models are trained using data sets that inherently represent a diverse faction of our society, including historically marginalized populations. Take African American people in the US, for example. There have been multiple studies on how certain cancers like breast, prostate, lung, and colorectal affect African American communities more than any other ethnic group. But even today, the community is virtually absent from the clinical trials that cancer researchers tend to hold. Here's the thing, AI won't see race. Since it will ultimately also terminate the need for any expensive and dangerous clinical trials, the issue of racial discrimination in cancer research would be reduced significantly. But that's not all. We have talked about how AI would put cancer patients at the center of the decision-making. One of the biggest issues with cancer treatment plans is that we simply don't have enough information about it. As all cancer cases are unique in their own ways, the unpredictability of treatment plans can derail patients' confidence as well. Researchers working on Cancer Moonshot researched the importance of creating patient-centered treatment plans and helped improve survival rates. For years, they have been stuck with solving this problem, though. But now, with AI-enabled tests, doctors will have streamlined and diverse data sets to understand how the side effects of selected therapy plans would interact with the patient in the long run. And this is a groundbreaking intervention. Prior to AI models, clinicians didn't have any mechanism to tell the patients how the benefits of a treatment plan would outweigh the adverse effects on their lifestyle or vice versa. Not knowing such options often leaves patients underconfident about their treatment, and even their commitment to therapy decreases. Artificial intelligence would change that and some more. Early detection of cancer. There's a small hurdle in the progress of AI in cancer research, though: government regulations or the lack thereof. Here's the thing. While governments around the world aren't opposed to using AI in medical sciences, their process to approve certain technologies has been slow. This is why certain AI-based startups researching cancer are pushing out important developments to catch the attention of governments worldwide. And the most important issue that they are tackling is the leading cause of death by cancer. We're, of course, talking about the late detection of cancer. Experts say that timely identification of cancerous cells is the key to successful treatment plans. And believe it or not, humans are not particularly refined at analyzing medical images, such as mammograms, Connecticut scans, and MRIs. There's no doubt that human prowess in tackling cancer has been extraordinary. But at the same time, clinicians and doctors are also susceptible to missing subtle abnormalities in medical images, because of either stress or workplace fatigue. Yep, that's an actual problem that plagues cancer research even today. How will Paige change the world? This is why the future of early detection of cancer lies in the hands of Paige, a digital pathology provider that is building the world's largest image-based AI model for identifying cancer. In September 2023, Paige's trajectory to help solve the detection problem changed forever when it secured a collaboration with Microsoft. Now, as a team, the companies are training an artificial model on a colossal amount of data, including billions of images and 4 million digitized microscopy slides. In a press release, the company cited, Paige will utilize Microsoft's advanced supercomputing infrastructure to train the technology at scale and ultimately deploy it to hospitals and laboratories across the globe using Azure. No wonder experts are calling Paige a major technology disruptor in healthcare. Specifically, Paige is working towards identifying both common and rare cancers that go undetected, leading to a major death toll, especially in countries with weak healthcare. The digital pathology model will also be a game changer for developing nations that haven't invested anything substantial in cancer treatments. Plus, researchers and clinicians who are finding it hard to keep up with staffing shortages and growing caseloads will also find the model beneficial. So just picture this. Instead of waiting 3 weeks for your diagnosis, you'll only have to wait for 2 days at best. That sort of first-pace detection is the driving edge between the life and death of cancer patients. A cancer diagnosis isn't official until a pathologist says so. And that decades-old practice of analyzing tissue under a microscope has resulted in more human errors than lives saved by treatment plans. Yep, it's that bad. Paige's models are already making cancer detection reliable and fast-paced. In 2022, the company released Paige Breast Lymph Node, the AI tool that helps pathologists in detecting metastases, the confirmation test of breast cancer. Impressed yet? Not to mention, healthcare systems all over the world shy away from digitizing microscopy slides for research purposes because it's very costly. Paige will make the process as easy as working on ChatGPT. What happens to cancer drugs? But of course, for projects like Cancer Moonshot, Paige technologies will be harmonized with other startups in town. Our biggest shout as of now is Ezra Flash, an AI-infused MRI technology that scans for possible cancer in the human body in up to 13 organs. And the best part? The process only takes 30 minutes while decreasing the cost per MRI by 30%. This is a game changer for the United States healthcare system that has earned notoriety for making patients go bankrupt. There's a common pattern in what startups like Paige and Ezra are doing. They are waging a battle against time that takes the best of cancer patients. Like other projects by Paige, Ezra has also secured 510(k) clearance from the US Foods and Drug Administration, or FDA. Yet there's one important tangent that we need to take a look at. What's happening to cancer drugs with the advent of AI? Well, for starters, cancer drugs are being infused with AI models to predict responses and side effects to the formulae. It might sound a tad ambitious, but AI startups like Pepper Bio are actively seeking to defy Irum's law. Yep, we all know the discovery and sophistication of drugs are decreasing despite technological breakthroughs. This is why startups are trying to fight the battle against cancer by reducing the costs and time it takes to put a drug on the market. Pepper is exclusively training its model, called Compass, with data sets that have been filtered for inefficiencies. As a two-step process, it has acquired large databases of clinical trials that were either sealed or were available commercially. Then Pepper, with the help of pharma companies like Merck, is training its generative models with viable datasets. But on top of that, the startup is doing something unheard of. After creating Compass, it is potentially going to move towards personalized cancer drugs for patients that would minimize the harms of any emerging side effects. Pepper believes that every cancer is unique within itself, and we can truly tackle cancer by personalizing treatment regimes that have the capacity to improve survival rates. By 2030, we will be looking at a new horizon of cancer treatments altogether. Found the video insightful? Give it a like and subscribe to our channel.